My name is Stephanie Gibbons, and I am currently a 3D print technician with MUN Med 3D here in the medical school at MUN. Previously, I did my BEng with mechanical engineering, and I'm currently an MSc student with biomedical sciences. Here at MUN Med 3D, I am our 3D print technician, so anyone who comes in that has a problem that they would like to go over, I would help them do any of the CAD files and get it ready to be printed. So I would collaborate with the people who have these innovative ideas typically to make their ideas come to life. In the lab as a whole right now, our goal is to work with students, faculty, clinicians to find innovative solutions to healthcare problems or to create simulators for medical education, that sort of thing. Currently working with a couple of undergraduate students who are using the lab to 3D print parts for their undergraduate projects. So one of them is looking at something related to ophthalmology, and the other person is looking at creating an attachment to CPR dummies to make them female. Right now, everyone's going through a global pandemic still, and that has really caused a lot of supply chain issues, especially from a 3D printing point of view, to be able to innovate ways to make something that you can't get right now because the supply chain is really backed up. How can we 3D print that or create it in some other way so that we're not slowing down the healthcare process? We'd love to see more students coming in with their undergraduate projects, clinicians who would like to have extra tools for medical education, or anyone in the faculty who again has an idea for a device related to medicine and healthcare that they've been thinking up in their brain. We want to hear from all those people so that we can try and make those things here in the lab.
I'm a PhD candidate at Memorial University in the Division of Biomedical Sciences in the cardiovascular group. I look at blood flow and type 2 diabetes. So type 2 diabetic patients typically have issues with exercise. We're actually looking at some of the potential mechanisms related to oxygen that are required in skeletal muscle to control blood flow. Our research is actually very heavily reliant on MUN Med 3D because of our innovative form of interrogating mechanisms. So with MUN Med 3D's help, we actually get to 3D print some additions to our microscope, and we can actually perturb a local tissue. So that provides us with a little bit more of a controlled environment. It's a little bit better than human-based research because we can actually interrogate specific mechanisms very locally. Health innovation is overall improving the health of the population. In general, type 2 diabetes is very prevalent in our population. Up to 95% of those living with prediabetes or diabetes actually suffer from type 2. So finding any of those mechanisms that are at play really helps to potentially improve the type 2 diabetic outcomes for patients. So MUN Med 3D has actually provided me, I actually completed my master's in the same lab. So I designed and validated a microfluidic device. So with MUN Med 3D's help, we actually were able to develop it and validate it within 2 years of my master's program. So that was amazing. Definitely a feat that we wouldn't have been accomplished without MUN Med 3D.
I'm the manager of medical laboratories for the Faculty of Medicine, and we support a lot of elements of the curriculum and research from biomedical sciences, community health, as well as undergraduate and postgraduate medical education. Several units are involved in the medical laboratories team, everything from electron microscopy, flow cytometry, to anatomy, multidisciplinary lab work, histology, and a lot of other groups that come together. And one of the major groups in terms of innovation that also are an integral part of this team is the MUN Med 3D lab. The whole realm of medicine has changed from the doctor on the table with a patient, and that's now started at the undergraduate level. So having something that's techie in medicine is now vital to medicine. The days of just taking a heart read or an EKG are sort of gone, and people are looking for innovative ways to make new bone casts, to make a new task trainer, and help provide everything from the elemental learning of medicine right through to the bedside. Health innovation has two big elements, and that's efficiency and cost savings. So when we have this type of facility that's available for clinicians right down to a new student, we have a huge knowledge base and fresh eyes always entering the facility. So that innovative sort of energetic vision that a lot of people have and just don't know how to process it can come to this site, discuss it with the team, and hopefully have a prototype or a readout that's actually a usable item a usable piece of equipment that'll help in innovation. Healthcare innovation is probably more important than it's ever been before for two reasons, and one is fiscally. The Health Accord and everything we see from that piece of documentation supports the idea that innovation is the only way we are going to drive forward with any kind of cost savings. And we've seen over time that throwing money at healthcare is not solving the basic problems of healthcare delivery. So innovation right now, I think, is the answer to that fiscal problem. And the other thing, of course, we've all heard the pandemic. So it just shows that we can pivot as a group, as a country, in a moment's notice to change things and change how we do things, and healthcare is no different. So facing supply chain issues, facing isolation, and all the things that go with that, we've been able to still continue to provide healthcare through our clinicians. We've been still able to support researchers, and a lot of that just came after being stuck in a situation where we had to find our way out. So right now, that sort of drive to be innovative, we've got the basis of it, and we need to keep rolling it forward.